Hello, I'm Dinesh Khanna from the scleroderma program at the University of Michigan. I'm pleased to summarize these data on the effect of nintedanib in patients with interstitial lung disease associated to systemic sclerosis or scleroderma and the risk factors for rapid progression. These are my co-authors. We know that the course of ILD in patients with scleroderma is variable and difficult to predict, but risk factors for rapid progression have been identified in a number of studies. These include early disease, male sex, elevated inflammatory markers, progression of skin fibrosis, and the presence of diffuse cutaneous subset. Recent trials have investigated the efficacy of particular therapies in patients with diffuse cutaneous systemic sclerosis and risk factors for progression. However, the SENSCIS trial was conducted in a broad population of subjects with systemic sclerosis-related interstitial lung disease, or ILD. In this trial, targeting lung fibrosis with nintedanib resulted in a 44% reduction in the rate of decline in the forced vital capacity, or FVC, over 52 weeks compared with placebo. We used data from the SENSCIS trial to analyze the rate of FVC decline and the effect of nintedanib on the rate of FVC decline in patients or subjects with risk factors for rapid decline used in the recent trials in patients with systemic sclerosis. In post-hoc analyses, we analyzed the rate of decline in FVC in milliliter per year over 52 weeks in all subjects in the SENSCIS trial and in subjects with certain risk factors at baseline. The risk factors we looked at were early disease, defined as less than 18 months since onset of first non-Raynaud symptoms, elevated inflammatory markers based on level of C-reactive protein or platelets, and significant skin fibrosis based on thresholds of the Modified Rodnan Skin Score, or MRSS. We also analyzed the rate of decline in FVC in subjects with one of these risk factors plus diffuse cutaneous subset. Here you see the proportion of patients who had the various risk factors at baseline. Almost 14% of the overall population had a time since first non-Raynaud symptom of less than 18 months, and approximately 37% had elevated inflammatory markers. As you would expect, the proportion of patients with risk factor based on the MRSs were higher in patients with diffuse cutaneous subset than in the overall population. In the placebo group, the rate of decline in FVC over 52 weeks was 93.3 ml per year. Compared with all subjects in the placebo group, the rate of decline in FVC was numerically greater in subjects with the risk factors. The rate of decline in FVC was numerically lower in subjects treated with nintedanib than placebo across all the subgroups. Similarly, the rate of decline in FVC was numerically greater in subjects with one of the risk factors plus diffuse cutaneous subset than in all subjects in the placebo arm, and was again numerically lower in subjects treated with nintedanib than placebo across all these subgroups. In conclusion, subjects with systemic sclerosis-related ILD in the SENSCIS trial who had early disease, elevated inflammatory markers, or extensive skin fibrosis had a more rapid decline in forced vital capacity over 52 weeks than the overall trial population. Targeting lung fibrosis with nintedanib reduced the rate of decline in FVC across the subgroups based on risk factors for rapid FVC decline. These findings support the prompt initiation of nintedanib in patients with systemic sclerosis-related ILD to preserve lung function and hopefully improve outcomes. Thank you for your attention.